In less than 3 weeks, COVID-19 has overloaded hospitals in northern Italy. Let's have a look at facts and fake news on this virus. COVID-19 is the first pandemic caused by a coronavirus. The name of this virus is SARS-CoV-2. But indeed, COVID-19 is also a serious infodemic because we have a lot of news and fake news on internet. We are here at the University of Teramo to provide information to our students, and we believe that this information can be useful for everybody, and students of scientific programs can be the drivers of evidence-based information. To identify reliable sources of information for COVID-19. First of all, the website of the World Health Organization, where you can find every week situation reports with the number of cases in China and outside of China, and maps with the distribution of cases. As you can see here, now the focus is not in China anymore, it's in Europe and exactly in our country, in Italy. That's why I would suggest you to visit the website of the Ministry of Health in Italy, where you have a portal with the distribution of cases in the different regions and in the provinces of our country. At an international level, I would suggest the website of the CDC, Centers for Disease Control, and in Europe, the European Centre for Disease Prevention and Control. And of course, the Ministry of Health in Italy and our National Institute of Health. We also have a portal for epidemiology in Italy that is connected with the National Institute of Health, and its name is Epicentro. For regulations and facts, I would recommend the website of the Italian Civil Protection. But now, let's have a look at facts and fake news on this virus. Well, coronaviruses are well known in veterinary medicine. So they cause diseases in animals and in humans. And in the last year, we know very well some diseases such as the MERS, Middle East Respiratory Syndrome, and the SARS, Severe Acute Respiratory Syndrome. Now we also know COVID-19. This is a new virus that was unknown before the outbreak of Wuhan in China in December 2019. And the name of coronavirus is coming from the image at the microscope that resembles a crown. So in Latin and in Italian it's corona. The most likely natural reservoir for this virus is believed to be the bat, but it probably jumped the species barrier to humans from another animal species, not identified yet. It might be domestic or wild. This virus is believed to be passed from human to human by means of droplets, so directly, especially when we cough or we sneeze. Cough is quite common in this disease. Or indirectly by hands, by shaking hands, for example. But be aware, bats can fly, but SARS can't. So the major problem is to be in direct contact, close to people who are positive, and exposed to droplets. The persistence of this virus in the environment has been estimated in several laboratory conditions, and it can last from hours to maximum 9 days. Actually, in one paper, they assessed the persistence for 9 days, but it was a specific strain and in specific conditions. In these papers, this is another paper, for example, evaluating the persistence on gloves and on gowns in hospitals. You can take samples from the patient room, as in this paper, or you can prepare viral suspensions, or assess the viral load and the persistence in samples in plastic plates. But in any case, these conditions cannot be compared with the conditions that we find in the streets or in our homes. So the infection by means of contaminated surfaces is considered possible but very unlikely, because the surfaces in our homes or in the streets are exposed to sunlight, to different conditions of temperature and humidity in comparison with labs, and exposed to cleaning products. And these conditions are believed to reduce the viral load or to affect the persistence. This is why, well, it's a good habit to change your shoes when you go home. It's a preventive measure, but it is not done on purpose for this virus. On the other side, it is absolutely necessary to be able to wash our hands correctly and thoroughly. And this is a video, you can watch this video for the procedure. It is very important to do it when we come home, often during the day, and always before touching our eyes, nose, and mouth, because these are the ways that the virus uses to enter into our organism. An infection by means of foods is considered unlikely but possible. For this reason, the World Health Organization suggests to avoid in this period raw or undercooked animal products, in particular raw meat, raw fish, raw eggs, and milk. And this is also applied to frozen foods, of course, for example, to sushi and other frozen fish, because the frozen state does not affect the vitality of this virus. SARS-CoV-2 can resist, as other coronaviruses, presumably for months or even years in a frozen state. And as far as foods are concerned, the World Health Organization suggests to follow the 5 golden rules to guarantee food safety. So first of all, to keep our kitchen clean, then separate raw and cooked foods. So in separate sections of the fridge, and by using separate tools to take it and to cook them. Cook them thoroughly and minimize the growth of microorganisms by keeping them at the right temperature. And of course, selecting safe food and raw materials. We can easily protect ourselves from this coronavirus, avoiding close contact with sick people and protecting ourselves and the others when we cough or sneeze. So using the elbow or a tissue and not our hand. Always avoid touching our eyes, nose, and mouth without washing our hands first. Washing our hands thoroughly with soap or water. If we cannot use soap or water, we can use a disinfectant, but at least 40 seconds would be better. 20 seconds is the minimum according to the World Health Organization and ECDC. But most of all, practice social distancing, at least 1 meter of distance. And most of all in this period, let's stay at home. It's very important for us. This is the only way we have to stop the pandemic. We don't have drugs, we don't have a vaccine, so we need to stay at home. Thank you very much for your attention.